All right, well, I think I'm going to go ahead and get us started just to honor everyone's time. And like I shared before, we will have a recording, so hopefully you can share out with your colleagues and maybe more people will join us today as well. Before we get started, I would like to invite Itzel with the Colorado Language Co-op to do an introduction to our language justice for today's session. And I think we've had a couple more attendees join, so we are just waiting for our interpreter to come back on. Hopefully, we're able to get started here in a moment. In the interim, we're inviting you to share your name, the organization that you work with, county or counties that you work here in Colorado or maybe outside the state in case you've heard about us from afar, and then something that you love about where you live. Thanks for everyone who has shared and who's joined us today. And it looks like we do have Itzel back now, so I'm wondering if we can go ahead and do an introduction from her about our language justice.
Yes, absolutely. Are you able to hear me there?
Yes.
Okay, perfect. Thank you, everyone. Sorry about that. And I will share some quick instructions in Spanish and in English. Hola, muy buenos días a todos o buenas tardes. Mi nombre es Itzel y estoy aquí para proveer los servicios de interpretación simultánea. Estoy aquí porque los organizadores de este evento se han comprometido con la justicia de lenguaje, así que queremos asegurarnos de que cada persona pueda escuchar y ser escuchado en el idioma de su corazón. Así que en unos segundos vamos a encender la interpretación simultánea. Y ya que la enciendamos, van a poder ver un icono terraquial o un icono de un mundo en la parte inferior de su pantalla. Ya que le haga clic a este icono, va a poder elegir entre el canal de español o el canal de inglés. Y este será el idioma en el que le gustaría escuchar y participar durante la sesión. Y es importante que cada persona elija un idioma para que cuando yo cambie de un idioma a otro, usted pueda seguir escuchando en el idioma que eligió originalmente. Y si en algún momento tiene alguna pregunta, alguna duda, por favor déjenos saber en el chat o con su micrófono. Estamos felices de ayudarles. Gracias. Hello, everyone. My name's Itzel, and once again, and I am here to provide simultaneous interpretation. So, a few instructions. In a few moments, we will turn on the simultaneous interpretation. And once we do, you will see a globe icon at the bottom of your screen. When you click on this icon, you can choose either English or Spanish, and this will be the language and the channel that you would like to participate and listen during the session. And it's important for everyone, participants, host, anyone who is participating, to choose a language if they are not bilingual in Spanish and English, so that whenever I switch from one language to the other, you will continue listening in the language that you originally chose. And I just ask everyone to please speak at a conversational pace so we can transmit the best version of your message. And if at any moment you have any questions, please let us know in the chat or with your mic, and we're happy to help. And we are good to start the interpretation.
Can I get a confirmation from folks that it is working? I just can't see it as someone sharing my screen. Okay, great. Thank you. And thank you, Itzel, for that introduction, and for joining us here today. We are very lucky to be able to provide the Colorado Equity Compass and all of our offerings as best we can in both English and Spanish. So we appreciate CLC's partnership in that. So at any point today, if you have to leave the meeting and come back, that interpretation feature is the same as you just selected, that little globe icon at the bottom of your screen. We do ask that you engage with that feature so that if we have folks in multiple languages, they can participate in their heart language. For webinar norms, we have a lot of panelists that you see here on screen today. Unfortunately, we do not have the ability to have everyone off mute at all times. We do have a portion of the session that will be conducted like a Q&A style. Depending on time, we might actually be able to have folks come off mute and do that, but it's done by specific controls. So in the meantime, we encourage you to participate through the chat. I think we also have a Q&A functionality as well that our team will be monitoring throughout today's session. So if you think of questions throughout, but you don't want to have to hold on to them and then forget them, please feel free to include them either in that Q&A or in the chat. If you have any technical issues, also reach out to our team there and we will be able to hopefully address those with you.
Oh,
We're seeing some scribbles on the screen. I love it. And today's session is recorded, so we get to see all of these fun little things happening. We will share the recording on our CEC YouTube, and we will also share out with anyone who registered for the session so that they can share with their colleagues or revisit anything that you're interested in. As you'll see at the end of our webinar, we also encourage you to reach out to our team. We don't bite. We are very sweet people and we would love to interact with you. So like I said, any questions, please put them in the chat and I will go ahead and move us into some quick intros for the folks on screen. We have a lot of folks here at the Colorado Equity Compass as part of a collaborative, which is a group of four companies that I'll get to in a moment here. So today we have Rachel Bauer, Matt Wiggins, and Anna Van Slyke. Pass on to the next folks, which are people who joined from my team at Change Matrix. And they will all be speaking or sharing today. So you'll hear a little bit more from us, but these are our faces on screen again for you. As I mentioned, the Colorado Equity Compass is a group of four organizations currently, the Colorado Trust, Change Matrix, the Colorado Health Institute, and Consume and Create. We all have various roles that make this whole thing work, and we'll be excited to share more about our story here shortly from each of our perspectives and from our different times joining this collaborative effort. All right, so I just wanted to share briefly that this is our vision for the Colorado Equity Compass. We envision that there are thriving communities that are empowered by their data and stories, and the rest of the team will kind of give you a little bit more insight into what that looks like for us. So I will pass it over to Anna to get us started.
Thanks so much, Alina. Yeah, so really, where did the Colorado Equity Compass begin? So the Equity Compass really grew out of an idea from the Colorado Trust in collaboration with a group of passionate individuals, really with a shared mission to democratize data and better support Coloradans to tackle the complexities of health equity within our state. So together, we really envisioned a tool that could shine a light on disparities and guide community efforts in building a more equitable and healthier future. So the story of the Equity Compass really begins with a realization seeded by decades of experience working and supporting communities across the state. And that realization really was, despite Colorado's natural beauty and vibrant communities, deep-rooted disparities were really undermining the health and well-being of Coloradans. Income inequality, systemic racism, and geographic disparities were really creating divergent paths to health outcomes. So a strategy was needed to really empower communities in understanding and addressing these often hidden patterns of inequity. However, existing resources really were limited both in geographic scope as well as their granularity. So resources were offering either specific information on only certain pockets of the state, or there was statewide data that was really obscuring trends at the local level. We also found that resources were often geared toward data and research audiences, which really limited the actionability of this information. So in response, the Trust, alongside community, identified the need for a comprehensive and user-friendly tool to provide standardized, statewide, and place-specific data on the social determinants of health in Colorado with the overarching purpose of equipping communities with the knowledge and tools to address health equities within our state. And I'll pass it to you, Sandra.
Thanks. So this commitment to equipping communities and really working alongside community members. So in this spirit, the collaborative engaged four communities to pilot the early version of the Equity Compass. And so through the early version of the Equity Compass, so it was a modest one, it really held promise and a commitment to better meeting the needs of communities. And so we strove to work with communities to better understand the disparities in health outcomes. And really, when you go onto the site, you'll see that it's really focused on social determinants of health, like income, education, and housing. And our early efforts were also centered around getting people and communities excited to use the platform. And early on in these conversations, it also became clear that we needed to move beyond what was currently available to create a platform, a tool that was dynamic and accessible, that could really illuminate hidden patterns of inequity. And through these early experiences, we also heard that health equity wasn't just about the numbers. Data is important, numbers matter, but that lived experiences and people's stories, that those were also really important. And so, working closely with these four pilot sites, it became clear that we really needed to move beyond what was currently available as well. So I'll pass it to Matt to continue the story.
Yeah, thank you, Sandra. When my company, Consume and Create, joined the collaborative, it was at the very start, and we were still confirming what it was going to be called. And so, after settling on a name, we set out to create a brand look and feel for the Equity Compass that was simple and familiar. We drafted off textbooks to create like an accessible, easy to understand brand and interface, with a logo representing a North Star that ties back to our goal as a collaborative to be the most trusted equity data source in Colorado. As the Compass evolved, we've worked to better integrate stories of communities' lived experiences into the platform. So it's not just a tool for analysis, but also a platform for community voices to be heard. And now we've just launched some new features that you're going to hear about later in the presentation. But with each iteration, the Equity Compass continues to gain momentum. It continues to become a more trusted source for community organizations, foundations, policymakers, and interested Coloradans to drive policy decisions, inform resource allocation, and facilitate collaboration to improve health outcomes. We continue to listen to what's needed and how the platform can be more useful and truer to its intention to address health inequities. We've worked to bring new data sources, more advanced analytics, and better integrated place-based information, bringing geotag data and stories into the same space. And while we're constantly looking to improve our qualitative and quantitative data, we're also trying to ensure the platform, has that original goal of remaining user-friendly and approachable for anyone who wants to know more about the places they live and how they compare to the rest of the state. And that's it for me. Yeah.
I think if you go to the next slide, I think Lauren is picking up the
Okay.
next iteration.
Thank you, Sandra. So I serve as the evaluator on the CEC. And so we wanted to share here that, as it says on the slide, feedback and community input are crucial to the CEC's planning and development. So to share an example of this, in 2022, we funded 12 organizations as storytelling awardees. And these are many of the stories that you can read about on the CEC website on the stories page. So this opportunity was a bit more passive, and it provided organizations with funds to write their stories about what inspired them in their work. But we learned that a lot of the community-based organizations that were writing stories needed more capacity and experience around data use and data storytelling to write more compelling stories. So in the last 2 years, we've done a more structured evaluation and gathered community input through focus groups, cognitive interviews, and through having a deeper understanding of what our engagement strategies and methods, which ones are most effective. So all of this information has continued to drive CEC's activities and strategic planning.
Yeah, thanks, Lauren. And all that background and history really brings us to where we are today, where we get to share this exciting platform with you all. So I'm really excited to take us into the present day and to talk about the different tools on the Colorado Equity Compass. So there's 4 tools that we want to highlight today. First is the Equity Data Navigator. The Navigator is a free, easy to use data tool that has some of the best population health data available in the state. And we'll talk about it more in just a second. But we know, we have this great data resource, but we also know that numbers don't always provide the full picture of the story, right? So we also have an extensive bank of community stories that Lauren was mentioning, some of which were collected via grants that the CEC put out. And they come in a variety of formats, including blogs, videos, graphics. One of my favorite stories is about Project Protect Promotores, which worked across the state during the COVID pandemic to connect agricultural workers with healthcare. And there's so much more incredible examples in that story bank. Once you've looked at the data and the stories available in the Colorado Equity Compass, we also have a resource bank for you. And this resource bank has a litany of different guides and toolkits, which really allow you to take all that information that you've gathered about your community and put it into action and figure out, how do I share this with others? How do I interpret this? What can I really do with this information? Examples of resources are guides for conducting interviews or focus groups, or even collecting your own data. And lastly, we have an advocacy module that is brand new, and we're super excited to tell you about it. And I'll let Nada talk about that in just a second. First, I want to get a little bit more into that Equity Data Navigator. So it's one of the primary resources on the Colorado Equity Compass, and it's an interactive data tool that allows you to see key data across Colorado about the social determinants of health and health outcomes. Research really tells us that many of the factors that influence health happen at the local level. And so when we were making this tool, we wanted to prioritize the most specific granular data possible so that people can get the data that's most relevant to them. Therefore, the Navigator allows you to compare and understand the quality of life factors for all counties and census tracts in Colorado. And if you add up all of those data points, then you have access to over 98,000 data points about health equity, which I think is pretty exciting. And as Lauren mentioned, we're always taking community feedback and incorporating it into the Compass. And so we made some updates this year around the data, increasing our data transparency and adding a couple new features. So one of the ones I want to highlight is our upgraded comparison feature. So we heard from community that they really wanted more statewide comparison ability. So how does my neighborhood compare to the state? How does my county compare to the state? And so therefore we added a brand new statewide data set and made our comparison feature easier to find and use. So now you can readily compare data from any part of Colorado to the state value, and you can also compare any combination of census tract / neighborhood to county. So you can really do a lot with this feature. To help you really explore this feature, we're going to do a bit of a demonstration of the entire site, which will start with the Equity Data Navigator. But first, I want to pass it over to Nada to talk about the new advocacy module.
Yes, thank you so much, Rachel. To kick us off, we want to highlight, like Rachel said, our newest tool here on the CEC website, which just went live today, the advocacy module. And this module was designed to support individuals and community-based organizations in using data storytelling to take action and advance health equity in Colorado communities. So whether you're just getting started or you've had prior experience engaging in advocacy, this module is meant to offer helpful pathways, tools, resources, and templates, and among other things that can assist you on your advocacy journey. And like the rest of the CEC website, this module and all of its featured tools are also all offered in English as well as Spanish. And before we go through a walkthrough of the module later on, we wanted to highlight some of its main features. So as you explore the module, you'll see a section at the bottom of the page that looks like this, where we feature different examples of opportunities to get involved and integrate you or your community's stories in your advocacy efforts. This section includes activities such as the ones shown here, posting on social media, volunteering your time, or engaging the media, as we see here, organized into individual cards. Next slide, please. From there, once you click on a card, the module walks you through helpful steps tailored to each activity. And at the bottom of the page, you'll find curated resources, including templates, links to websites, and learning materials associated with each activity. So I will now pass it back to my colleagues so that we can begin our demonstration.
Yes, thank you everyone, and thank you Nada for highlighting that brand new section. So at this point, we'll invite you all to follow along. You can visit the coloradoequitycompass.org, for Spanish, you can do /ES. And you can also see the toggle at the top of the screen. I will show you here shortly. But I do invite you to follow along. You can also access the site on your phone. I do think it's best experienced on the computer, but both are available for your use. So let me stop sharing here for a second and I will reshare the site. Hopefully that does not mess with interpretation again. All right, everyone able to see that okay? Perfect. So this is the toggle up here on the right-hand side. You can find that at any point on the site to toggle between English and Spanish. And we will go ahead and walk through the English version of the site. And Rachel, I think you're going to kind of narrate while I walk us through. Is that correct?
Yeah.
At least
Yeah,
for the
thanks for piloting, Alina. So let's dive in, right? So first, let's look at the Equity Data Navigator. So this is our landing page, and in order to actually get into the Navigator, you need to pick a county to begin with. So let's go ahead and get into Pueblo County. Alrighty. So what you see here is a map of the entire county of Pueblo. And there's also different sections, and these sections are called census tracts. And they contain about 4,000 people in them. And so, the ones where it's a little denser, they're much smaller. And the ones where it's more rural, they're much larger. So they have a lot of variability, but it does provide a lot of specific local data for you to look at. So one thing I want to highlight about this map is that as you click around to the different areas, that will actually change the data. So you can see the whole countywide data, or you can click on a specific area to see that data. You can also use a zoom in and zoom out feature in that lower corner right there. So you can get a little bit better look at the different streets and navigation of the county. So the first data we can look at is over on the right-hand side of the screen in this white box. This shows a lot of general statistics about Pueblo County. So we have like language spoken at home. And as we scroll over, we'll see other things like education, median family income, some of those really key statistics about this area. That includes population by race and ethnicity. And if you keep going, you can see some of those key statistics broken down by community group. If we look at the bottom of the screen, we can see four key health statistics here in blue, including the average life expectancy and self-reported good health and mental health, and also a measure of racial diversity of the county. If we continue to scroll down, we get more into those social determinants of health. So those things that aren't strictly related to your physical health, but really have an impact on your overall well-being and life. So there are several of them listed here, and you can also see that they're also graphed out. And so for Pueblo County, we can see all the ones in orange are below the state value, and all the ones in blue are above. So we can see that economic, education, food, and housing, and social are below, and environment and health services are above the state value. And if you're wondering, okay, how are these scores determined? You can click on any of the social determinants of health. Let's go ahead and look at one. And you can actually see the data that goes into this score. So for food, we looked at the average meal cost, the amount of people who can afford food, and the amount of households receiving SNAP. And all of that informs our comparison to the state value. And again, as you click around the map, all this data will change. And so you can look at whatever neighborhood you want and look at every single social factor and the score and see how it really compares to the county and other census tracts and all that. And there's more to explore here, but I want to make sure we have time for all the other cool elements of the CEC. So the last thing I'll highlight about the Navigator is if we scroll all the way down to the bottom of the page, there's actually a link where you can download the entire data set. So every single of those 98,000 plus data points is freely available for you to use in a large but very friendly Excel file that you can use for your own research and purposes. I'll also drop links to complete walkthrough videos in both English and Spanish, where you can fully explore the Equity Data Navigator, including this comparison tool, and really figure out how to best use it for your purposes. But I want to make sure we have time for all the other stuff, so I'll go ahead and pass it on to the next person so we can talk about the advocacy content.
Yeah, thank you so much. So now that we've introduced the advocacy module and kind of the overview of the activities that are provided, we hope that this walkthrough gives you a better understanding of how it's structured and how you might use it in practice. So we're starting here on the landing page, where you can begin to move around and explore depending on your own level of experience with advocacy. One thing I do want to point right away is that navigation bar, the red navigation bar up there at the top. This is your menu for moving around throughout the module. And so depending on your need, you can jump straight into background content, learn more about the data storytelling cycle, or jump right into the activities. Scrolling to a little bit further up, please, in the middle section, why is data storytelling effective in advocacy? Thank you. So if you're newer to advocacy, or you just want to ground yourself with some introductory explanations, you can start with this background section. It includes short explanations of what advocacy is, how it connects to health equity, and how data storytelling strengthens advocacy efforts. Moving further down, we get into the data storytelling cycle, which outlines 5 steps that guide you in assembling the narrative, data, and visuals to support the story of a community. And each step includes a clear summary and overview of the goal, helpful questions to consider as you move through, and suggestions for how to involve and engage your community in that step, and links to toolkits and resources that support the step as well. Step 5, in particular, brings in data storytelling and how it can be used to drive meaningful action in communities. So below that, we then get into the advocacy activities, which are the cards that we previewed earlier. Each one represents a specific action someone might take, either individually or as part of a larger group or organization. On the left-hand side up there at the top, we've got built-in filters to help users find activities that are most relevant to them. You can filter by scale. So whether I mentioned this right before, you're working as an individual or within an organization, there are also certainly lots of activities that do cross over and apply to both. Then we have the type of activity right below that, which includes writing correspondence, education, which is somewhere you might go to continue building that foundation of advocacy, as well as participating in organizing events such as lobbying, call-in days, etc. And then that third filter we have is level of effort, organized into low, medium, or high, depending on your needs, your capacity, and your time. So for example, if you're just starting out and you're looking to build that foundational knowledge, you might select education as your activity type. That brings up 2 activities: identify your locally elected officials and understand the types of advocacy. For this example, let's go ahead and open up understand the types of advocacy, please. So when you open up that card, you see a brief overview of the type of activity up there at the top, followed by some helpful steps right below to walk you through how you might engage with that activity. We also have suggestions included throughout for how to involve others or expand your impact. And just below that, we've got a set of curated resources such as reading materials, templates, or websites to help support you. The layout is really designed to make each action feel manageable, and each activity card follows a very similar structure. So once you've kind of explored one, you'll know what to expect from the others as well. And I'll close by noting that this is a living resource. So as new tools, examples, and activities are identified, we'll continue to update the modules. So we invite you to revisit it regularly if you'd like, and share it with others who might benefit as well. And if you have any questions or concerns as well, we encourage you to reach out to us and let us know. And I'll pass it back to Alina.
Thank you, Nada, and thank you, Rachel, both for that walkthrough of the website. I'm very excited to see those highlighting new features. And I just want to share with everyone, I've been working on this project for about 6 years now. And I'm really excited about this advocacy piece and that we get to share it because it does really see through a lot of what we envisioned for this platform, this compass, to kind of serve as a way that folks can navigate around the different health inequities that they experience in their communities, taking the equity data navigator and looking for data points around like what does health look like in your area. For example, I'm in Routt County, and I'm just kind of curious whether it's from a personal or professional standpoint, kind of what this data means and what it says. I will share that there are inconsistencies sometimes that you see within the data, and we want to make sure we are highlighting that as well. One of the pieces that we didn't get to touch on, but I feel are really important, are the stories that go alongside the data. And maybe they are confirming what the data say. Maybe they're saying, okay, in this county, so this is my little area neighborhood. We're getting personal here. My food is not great. Like the average meal cost isn't great. And I can tell you that that's confirmed with, I actually think this is pretty low for the cost of a meal, but that's something that we invite. We want to hear stories about what are the actual lived experiences from folks who are in these areas, who are working alongside folks who are experiencing a lot of health inequities. So we do have these community stories, which are place specific. So if you go to a specific part of the Colorado Equity Compass and you put in your county, we do have stories tagged in specific places. I actually don't know if we have any specific for Routt County right now, but they will be coming soon because we are engaging with some folks through our capacity building to create some more stories. But you can also find stories across the state of Colorado or for your areas. We do have a whole separate stories bank part that has some newly updated stories from Data Use Learning Collaborative folks that we had worked with in the last year. So that's exciting. I wanted to share that. The filters look very similar to what you saw Nada walk through for the advocacy module. So hopefully that feels familiar. So we really see this whole site now working together, I think. You can look for data in the Equity Data Navigator. You can download that data if, like Rachel, you're and me, you're a data nerd and want to see more about that. Combine it with your stories. You can use you can quote stories from here on the website. You can look similarly if I wanted to see ones around food. I can look at what are the stories, what are people sharing about food. And then what do you do with that? How do you take that and make it into a data story? We have some resources on our resource bank. Again, similar filters, shout out that, and shout out Matt's team for creating such an accessible website. But we have some resources that can help you build your data story, which you can then go and see from the DA's new advocacy module. What do you do with that? Who do you tell? How do you talk about that? In what spaces? So we're really excited to share all of these parts of the Colorado Equity Compass, and we welcome your questions, your ideas, anything really about this compass that we're excited to share. And I think at this point, I'm going to pass it back over to Sandra from my team to kind of lead us through a little Q&A.
We have at least 10 minutes if anyone has any questions. So here we have one question from Logan. Is there a way to group tracks or to look at the data by zip code?
Right now we're not able to do any grouping of tracks or look at the data by zip code. If you want any help though with being able to do that, feel free to reach out to us. We're always happy to help people kind of troubleshoot data. Our data download file can help with that a little bit because you're able to download it and manipulate it a little bit. But sometimes you might need like extra supplementary data about population counts or something, and we're totally happy to provide that. So reach out if you have any like specific questions that you'd like some help with. Happy to provide that.
We are able to provide some support and some TA. So yes, please log in, reach out. Any other questions or thoughts? Yeah, thanks for your question, Logan. I'll maybe do another plug for our story bank, just to say that a lot of our stories tend to be focused on the Front Range and Denver area. We would love to have more stories from outside of the area. So if anyone representing other parts of the state, please send in your stories. And we would love to just feature some of the great equity work that's happening around the state and have just better representation. There's a question from Logan around, can you speak to sustainability in the current funding and administration? Well, I can. That kind of speaks to a little bit of what I was going to share in the closing. I mean, we've been fortunate to have funding from the Colorado Trust, and we so have appreciated that. Because we don't receive federal funding, we haven't been affected directly by what is happening with the federal administration. But we are in a position we are seeking other funding. And so, because of the funding that the trust has provided, we've been fortunate that we've been able to provide the platform, the data, training, and I haven't even mentioned capacity building, which I'll speak to in a second. But we've been able to provide all of these supports at no cost to communities across the state. And so in order to continue to do this, we will have to seek additional funding. And so if anyone's interested in being a supporter, we're of course open to that. And so what I don't think has been touched upon is that over the past year, we've expanded our offerings to provide more intensive capacity building. And so the group at CHI offered a 4-month intensive learning collaborative focused on data use. And then our team at Change Matrix we're in the middle of a 9-month learning collaborative focused on data storytelling. And those have been really interesting and I think helpful experiences for the participants. And so they've really been involved monthly meetings, almost all virtual based, with individual support, technical support in between the sessions. And for the data storytelling, we're focused or supporting the organizations to implement an advocacy project at the end of their session. And so if anyone is interested in sponsoring a learning collaborative for their organization, please reach out to us because we're definitely in a position to support more in the future. So there's a couple of other questions that have come in. One from Didi around language is moving away from social determinants of health. I would say no, we haven't moved away from, if I'm understanding your question correctly, we haven't moved away from referencing social determinants of health. That's still the language that we're using on our site.
Yeah, I can share really briefly on that. We had done a lot of work. Now, granted, this was at the beginning of the Colorado Equity Compass, to kind of determine both how we're speaking about the social determinants of health, what are included in that, because we know that a lot of folks have different language, different factors that they do include that are impacting health. And it felt like using SCOH was the most familiar for folks, particularly within public health. But we also try to break down a lot of that jargon in terms of like talking about the specific determinants, right? Or the specific factors that are impacting folks' health. We talk about that, including systemic racism, which a lot of folks don't, right? So that's something that we have specifically called out at the Equity Compass. And we see a lot of value in talking about the specific factors. But I think for shorthand and to hopefully be understood in a lot of particularly public health spaces, we've been working a little bit with the Colorado Department of Public Health and Environment. So those are familiar language, I think, for a lot of public health professionals, as well as I think relevant kind of jargon for folks who are interested in working in these areas as well. So those were things that we had considered, but it felt like that was the most familiar and something that folks could kind of resonate with.
Mm-hmm. And I think there's also some more questions around funding. I think that we're still in the process of identifying like what our funding goals are. And if you're curious and having further conversations, we'll certainly reach out to you afterwards, Emily. And we can certainly send out more information about the learning collaboratives. And the learning collaboratives that we've implemented are pretty intensive in the sense that we're supporting groups of 6 and 8. So 6 and 8 organizations, and each organization with 1 to 2 participants. So they're pretty small, they're intensive, and we're also adaptable in the sense that we're able to offer different formats and formats for larger groups that are less intensive and less hands-on. And so we're exploring other options for different formats as well, that may be more accessible or more cost-effective, and just may be a better fit for certain organizations because not everyone can accommodate a 9-month learning collaborative. That may not be feasible for everyone to participate in. And so happy to talk about what possibilities are. And I'd love to hear more about CPHA's, you mentioned, has a Stories of Impact initiative.
Yeah, hi. This is Dee Dee Pearson with the Colorado Public Health Association. It's not uncommon right now to be collecting stories of impact on changing federal regulations, particularly in the public health space. It's public health authority, it's regulatory, and it's funding. And because those stories are so important for policymakers, as well as for us to understand what's going on with our members locally and regionally, as well as statewide, we just launched, again, a Stories of Impact, where we're trying to understand on the ground what is changing and what is being affected. And not surprisingly, because of the bent of what's happening at the federal level, a lot of that is around public health and equity programs, equity initiatives, equity work.
And what are you doing? What are you all doing with the stories, I guess, once you're after you collect them and document them?
So the two things I just mentioned, one is making them available to policymakers so they understand what's going on in their districts. And then again, for us to understand trends locally and regionally and statewide and understand what our members need to do to help them respond.
Well, if you're interested in disseminating more broadly, I think we would welcome a conversation.
Yeah, I'd love to have a follow-up conversation. Distribution will depend on each person gets to select sort of what they're willing to do.
Yes, of course.
And so yeah, but I'd welcome a follow-up conversation. We just launched it. So we'll see what we get. But we also have a big annual conference coming up, and we're going to be sort of repping it at the Public Health in the Rockies conference as well.
Oh, great. Well, we will have someone there, actually. Maybe I'll kind of transition us to our wrap up. We're going to be, so CEC will be presenting. So we'll be presenting at Public Health in the Rockies. So Lauren on our team will be there, and we're scheduled to present on September the 10th. So please come and support us and connect with Lauren. And we also we'll have someone from one of our learning collaboratives representing integrated community there. And then, as I mentioned before, we're super grateful to the Colorado Trust for their ongoing financial support and are in the position now that we are looking for other supporters as well. And anyone interested in sponsoring learning collaboratives, right now we're able to support learning collaboratives around data use as well as data storytelling. And then there's other ways to stay connected with us too. We're always looking to build our story bank, as I mentioned before, and really highlight the great equity work that's happening around the state. And you can follow us on social media and our new quarterly newsletter as well to stay up to date. And we're always looking for feedback. So if someone hasn't already shared the post-event survey in the chat, please do so. Yeah, we appreciate everyone joining today. And for those that will view this later, and hopefully this did provide an overview of what's available, the data and the resources that are available at the CEC website at no cost to you. And hopefully you'll go and we'll use them and we'll provide us feedback. We're always looking to hear how this information and the data and the resources are useful as well. Thank you, everybody.
Sandra said, please reach out if you have any questions, and we will send a follow-up email from this webinar as well with links to all of the things that we've mentioned today, as well as ways to stay in contact with our team. So thank you again. Please do reach out with questions and any follow-ups. We'd love to hear your stories. And thank you, Itzel, for doing the interpretation of our session. Good job, collaborative. I will end the webinar now. Thank you, everyone.